Tonsil stones, causes, treatment, and prevention. For a few years, this man thought he was just prone to bad breath. He would brush, floss, and even chew gum now and then, but somehow the smell kept creeping back. Sometimes he would feel something weird stuck at the back of her throat, like tiny grains. When he coughed, he would see small, foul-smelling particles come out, but he thought it was usually particles from his last meal. So, one faithful morning, he was scrolling through his timeline, and she saw this post, Tonsil stones, causes, and remedy. For the first time in years, everything made good sense. Those tiny, grain-like particles were not random at all. They had a name, a cause, and thankfully a solution, too. Do you have this experience, too, or do you know someone? Let's learn together. Come with me. Your tonsils are the two fleshy pads at the back of your throat that function as part of your immune system. They produce white blood cells and antibodies to fight infections. What then are tonsil stones? Tonsil stones are also called tonsilloliths, and they are hard formations of debris that accumulate in the crevices of your tonsils. They can vary in size from a grain of rice to as big as a grape. They're those little buildups on your tonsils that can cause serious bad breath. How does it occur? Usually, your tonsils have deep crevices called crypts. These crypts can trap dirt, food particles, and other debris as they pass down your throat. First, debris, such as food particles, dead cells, bacteria, and other substances, becomes trapped in the tonsillar crypts, deep crevices in the tonsils. Over time, this debris hardens and calcifies, forming stones. The presence of calcium in the debris contributes to the hardening process. Symptoms of tonsil stones. 1. Sore throat. When the tonsils are inflamed or infected due to the presence of stones, persistent sore throat can occur. 2. Bad breath. When particles are trapped in the tonsil stones, bacteria feed on them and produce sulfur compounds, causing bad breath. 3. Cough. Due to the irritation caused by tonsil stones, your body makes an effort to clear the debris, which can lead to a chronic cough. 4. Earache. The pain from inflamed tonsils can cause ear pain. Difficulty swallowing. If the tonsil stones are large, they can obstruct the throat, making swallowing difficult and even painful sometimes. Causes of tonsil stones. 1. Accumulation of debris. Food particles. If you have deep crevices, food particles can get trapped in the tonsillar crypts. Dead cells. Natural shedding of old cells by your tonsils can cause those cells to accumulate in the crypts. Bacteria and mucus. In the crypts, bacteria and mucus can also get stuck, which leads to the formation of tonsil stones. 2. Chronic infections. Frequent tonsillitis. Due to recurrent infections, inflammation can always occur, making the crypts deeper and more likely to trap debris. 3. Chronic dehydration. Dry mouth can result due to lack of sufficient hydration, which reduces the natural flushing action of saliva that helps clean the tonsils. 4. Deep tonsillar crypts. This is an anatomical variation. People who naturally have deeper tonsillar crypts are likely to be more prone to accumulating debris. How to dislodge tonsil stones. Water flosser. Aiming a water flosser directly at the tonsil stones helps to dislodge them. The debris can't flush out with the steady stream of water. Ensure to use the flosser in a gentle setting to avoid damaging the delicate tissues of your tonsils. Gargling with warm salt water. Dissolve half a teaspoon of salt in a cup of warm water. Gargle with this solution for 30 seconds to a minute. The warm salt water helps to reduce inflammation and loosen the stones. This can be repeated several times a day. Cotton swab method. This is gently pushing the stones out using a cotton swab. Wash your hands and be very gentle to avoid causing bleeding or infection. Doing this in front of a mirror to see where the stones are located is important. Coughing. Sometimes a strong cough can dislodge the stones naturally. This can happen when the stones are small and close to the surface. Professional removal. This is usually done by a dentist and most times involves large stones. They use specialized tools and techniques to safely remove the stones. My advice is that no matter the size of the stones, seek medical help first. Complications. 1. Persistent bad breath, halitosis. This can affect your social interactions and self-esteem. 2. Repeated throat infections. This can lead to more severe conditions and may require more serious intervention like tonsillectomy, surgical removal of the tonsils. 3. Swelling or inflammation of the tonsils. If this is persistent, it can obstruct the throat, making it harder to breathe and swallow properly. 4. Severe ear pain. This can affect daily activities. Difficulty swallowing. This can lead to issues with eating and drinking, potentially causing weight loss or dehydration. Prevention. Stay hydrated. By drinking plenty of water, you help to keep your mouth and throat moist, reducing the chance of debris getting stuck in your tonsillar crypts. Maintain good oral hygiene. Brush your teeth twice a day and floss daily to minimize the buildup of food particles and bacteria in your mouth. Gargle. When necessary, gargling with water or recommended mouthwash can help dislodge any trapped particles and keep your mouth clean. Examine your tonsils. Regularly check your tonsils for signs of stones. Do this more if you feel something unusual in your throat. Use a tongue scraper. Keeping your tongue clean can help reduce the bacteria in your mouth that contribute to tonsil stone formation. Avoid too much sugary foods and drinks. This can help prevent the growth of bacteria that contribute to bad breath and tonsil stones. Consume probiotics. Eating probiotic-rich foods can help balance the bacteria in your mouth and reduce the chances of stone formation. You can effectively manage and prevent tonsil stones by maintaining good oral hygiene. Your oral contributes hugely to your general well-being. Did you learn from this post?